Story Western Mass News continues to follow. The Baystate Mary Lane Emergency Room in WARE will be closing in June. Over the last 2 years, that hospital has shut down most of its facilities, leaving it only operating as an outpatient care center and ER. Many residents and town officials disagree with the decision made by Baystate Health. They say this could put many patients at great risk. Western Mass News reporter Baystate Mary has the details.
5 more minutes, the doctor said she would have died.
WARE residents Chrissy Flowers and her husband Eric have visited the Baystate Mary Lane Emergency Room in town twice over the last 6 months. Over the summer, Chrissy was experiencing septic shock. Her husband immediately rushed her to the ER.
Mary Lane stabilized her within 15 minutes and got life flight her over to the trauma center.
The couple says if they had to travel any further, they're unsure if their 3 children would still have both of their parents.
They would have lost their mother that night.
They are frustrated with the recent news that the emergency room and outpatient care facilities at Baystate Mary Lane will be closing in June of this year. Baystate Health issued a press release in January saying in part, quote, "Despite our significant investment in this location during the past several years, patients are choosing to receive care in other locations." Alan Whitney, the chairman of the WARE Board of Selectmen, tells Western Mass News they are disappointed in the lack of concern for the residents of WARE.
We just want them to come to the table with, good intentions and talk to us and help us either shop this hospital around to somebody that might want to use it and provide health care for the area, or work with us on a plan to shut everything down and take care of the building.
With the closing of the ER, that leaves residents with the option of going to Baystate Wing Hospital in neighboring Palmer. A bridge that connects the 2 locations and is the fastest route is set to close for construction next spring. With no hospital and no bridge, Whitney says this could put critical care patients in danger.
It's already a good 20 minutes to get there. You add the bridge traffic, now you're at 40 minutes.
And construction on this bridge would add more travel time to patients and emergency responders.
You start adding travel time into it. It just it complex the issue at hand for any emergencies headed to that facility.
The couple says if nothing else can be kept at the site, at least keep the emergency room, which saved Chrissy's life.
What if it was their family that was in need? 5 more minutes,
Right.
What if it was their family that 5 minutes would have killed their family?
And then had 3 kids lose their mother,
The town is asking Baystate to consider keeping the emergency room open until at least the bridge construction is complete. We have reached out to Baystate Health for comment, and at this time, they have declined our request. In WARE, Baystate Mary for Western Mass News.